This is Health Assessment 3310. We are going to do a head-to-toe assessment just so that you have an idea about what it is that we expect from you on final checkoff day. We're going to assume already that the patient that we're seeing is here just for an annual physical, that we have already done his vital signs and have recorded them. But make sure that you are prepared to do your vital signs when you come in the day for checkoffs. Okay. Brian, Dr. Outlaw.
Nice to meet you.
Nice to meet you too. I know you're in here for just a regular physical today, right?
Right.
Any problems or anything?
Nope.
Okay. All right. Well, this is rather an extensive assessment, so it's going to take us probably about 30 to 40 minutes. Okay. I'm going to be asking you to do several different tests, and we're going to be going through some different exercises. And if at any time that you feel uncomfortable or that you have that you're not able to do anything, make sure that you let me know and I'll stop.
Okay.
Okay. All right. So the first thing I want to do is I just want to look at your skin. And I'm looking at the color of it, the vascularity of it. I want to check your skin fur. Look like you're well hydrated. Okay. You have really vascular skin, probably because of your being so physically active. I'm going to look at your hands and your nails. Your capillary refill is less than 3 seconds. I don't see any kind of clubbing. What I want you to do for me, Brian, is I want you to put your index fingers together for me like this. Okay, hold them up for me so that I can see them. Okay, so that they touch for me. There we go. Okay, that's called a shamrock test. What we're checking for is we're looking at the angle of your nails, and yours are fine. They should be less than 160 degrees, so yours look just fine. Okay, the next thing I want to do is I want to look at your head and your scalp. I'm looking at the contour of your head, looking at your hair in general. You don't have a lot of hair up there, so keep it short, which is good. All right, so I'm just inspecting it, looking for any kind of lesions, any abnormalities, anything like that. I want to look at the texture of it, the luster, I know the color, whether or not that you have any absence or excess. It's very evenly distributed. So I want to palpate your skull. You feel any kind of tenderness or pain when I do that, Brian?
No, it feels pretty good, actually.
Okay, all right. Most people tell us that. I don't see anything as far as any kind of flaking or no scalp problems or anything like that, right?
Right.
Okay, all right. So we kind of looked at your skin, at your hair, and at your nails. Now we want to look at your head, your neck, and your face. Looking at your face, I can see that your 2 eyes, of course, that are evenly placed, symmetrical. Your nose, your ears are symmetrical as well. Notice that you have facial hair that's also evenly distributed. I want to go ahead and I want to palpate your face. Any kind of pain or anything like that?
Nope.
All right, I want to palpate your frontal and your maxillary sinuses. Any pain with that? Okay. If you did have a sinus infection, it would be uncomfortable when I palpated you right there. Okay. All right. We'll look at your neck. Looking at your shoulders, they're even height. Okay. I want you to, if you will, I want you to shrug your shoulders for me. Okay. That's actually assessing cranial nerve number 11, which is your accessory nerve. So it's fine. Go ahead and I want to see you swallow. Just take a sit for me and put your head back when you swallow so I can see your trachea move. Okay. All right. That is also assessing cranial nerve number 10, which is your vagus nerve. Okay. Now I want to palpate your trachea. Kind of pain or anything like that? Okay. All right. I want to assess your thyroid, make sure that there's not any enlargement or any tenderness with it. So what I want you to do for me is I want you to take a sip of water and hold it in your mouth. And I'm going to give you some directions about how to hold your head. And then when I ask you to, I want you to swallow for me. Okay. And I'm going to kind of stand behind you. Okay. I need you to put your head down and to the right for me. Okay. All right. Now what I need you to do is swallow. Okay. All right. Can you do that for me one more time and then put it to the opposite side? Very good. Okay. Now I'm going to listen to your thyroid just to make sure that you don't have any bruise. Bruise is just bruise just means that you have increased blood flow to that area.
Okay.
Could be also indicative of a abnormal thyroid. Okay. here, I'm going to go ahead and I'm going to palpate your carotids. Do them one at a time because I don't want you passing out on me. Okay. And while I'm here, I'm going to go ahead and do your temporals as well. Okay, sounds good. Okay. I am going to palpate your lymph nodes. It's not abnormal to have some lymph nodes that are enlarged, but you haven't noticed any changes, any discomfort from any lately? Okay. All right. These are your preauricular, your postauricular, your occipital, your retropharyngeal, your submaxillary, your submental. Okay, and if you will, turn your head for me this way, kind of tilt it to the side. It's your sternocleidomastoid muscle, and underneath this are your deep cervical chain. Okay, in front of this is your anterior cervical chain, your posterior cervical chain. Okay, once you go on the other side, so turn the other way for me. Okay, don't feel anything. Okay. And then I'm going to feel above your clavicles for your supraclavicular. Not a whole lot of room in there, Brian. And then below them for your infraclavicular. Okay, all right. Okay, let's move on and look at, let's go ahead and look at your ears. Or do anything else. All I want to do is just look at them so that before that they're evenly placed, that outside of your canthus lines up to the top of your ear. I want to palpate them. Any tenderness or pain with that?
No.
Okay, I also want to palpate your tragus. Okay. Now I want to look at the inside of your ears with this otoscope. What I need you to do for me is, if you will, tilt your head slightly to the side. There we go. Okay. I'm going to pull up and back. Insert. Ooh, perfect. Pearly gray, absolutely beautiful. Okay, now we're going to look at this other side, so if you'll just tilt to the other side for me. I'll pull up and back again. Very nice. Okay. All right. We've looked in your ears. Now what I want to do is a couple tests just to determine whether or not that you've had any hearing loss. Do you have any problems hearing, Brian?
No.
Okay. I'm going to do a couple tests. One is called the Weber test. And what I'm going to do is I'm going to strike this tuning fork and I'm going to set it in the middle of your head. And I want you just to tell me whether or not that you can hear it equally in both ears, or whether you hear it in one ear more than in the other, and which one you do hear it more in, if you do.
Okay.
Does that make sense? Okay.
Yeah,
All right. All right. Here we go.
See.
Okay. All right. Now this one is checking your bone conduction versus air conduction. In individuals that have normal hearing, you should be able to hear sound twice as long from your ears for air conduction as you do on the bone. So we're going to first, I'm going to strike the tuning fork again. I'm going to put it on the mastoid process behind your ear. And when you stop feeling it, I want you to tell me that you can't feel it anymore. Then I'm going to move it to the front of your ear, and then I want you to tell me when you stop hearing it.
Okay.
Okay? Okay, 7 and 25, so you're really good hands on that side. Okay, so we're going to do this other side.
Okay. Okay.
12 and 18. A little bit different, but it's just fine. Okay. Now I want to check your balance. I want to make sure that you don't have any problems with equilibrium, so I'm going to get you to stand up for me. Okay. while I'm checking your bounce, I'm also going to assess cranial nerve number 8, which is called your vestibulocochlear nerve. Okay. So what I want you to do for me is I want you to put your hands out to the sides, like so, and I want you to close your eyes, and I want you to lift one foot up. Okay. That's okay. Go ahead. Lift one foot up one more time. Okay. Now put down. Okay. Now the other foot. Okay. All right. Very good. Very normal. A slight amount of swaying is always okay, so it's really not a big deal. Okay. All right. I'm going to just sit back down. I'm going to look at your nose and I'm going to look at your mouth next. While I'm looking at your nose, I already told you that it was centered, it was midline. Don't see, doesn't look like you've ever broken it or anything like that. Well, they did a good job of repairing it then. Any problems with sinuses or allergies or anything, Brian? Okay. Never had a deviated septum or anything like that? You have. Okay.
Yeah, you can still tell it's set a little more on the left side.
Okay. All right. So what I want you to do is just tilt your head back for me. Okay. Well, before I have you do that, I'm sorry. Let me just feel. All right, now I'm going to have you tilt your head back, and I'm just going to look. Oh, you definitely can tell.
Mm-hmm.
Wow, yeah, okay. All right, so, but no problems with being able to breathe or anything like that?
No, it's not anything that gives me any problems.
All right, good deal. Okay, now the next thing that I want to do is I want to check to make sure that because you've had that happen, I want to make sure that there's no problems with being able to smell. Okay, so what I'm going to do is I'm going to include one side of your nares, and I want you just to breathe out gently, and then I'm going to include the other side and do the same thing, okay?
Okay.
I'm going to include this side. Okay, do this side. Okay. Now, the next thing I want to do is I want to actually check that smell. Okay, so I need you to close your eyes. Okay, and I want you just to tell me what you smell. I'm going to include this nostril. Just take a sniff. Can you smell it?
Can't tell what it is though.
Try it one more time.
Yeah, I couldn't tell how strong
It's hard
it was.
to, yeah, okay. All right, vanilla, you're right. Okay, let's try the other side. Okay, I'll include this one. Smell that one so you can determine that one.
Something.
All right. Okay, well that's good. And I did try to pick things that you would know. Vanilla, cinnamon, cooking things.
Maybe chocolate cookies.
I should have got that, okay. All right, next thing we're going to look at is your mouth. Okay, so the first thing I'm looking at is just, I'm looking at the condition of your lips. They're not chapped, there's no, you don't have any fissures in the corners, there's no lesions, nothing like that. So I'm going to palpate them. So let me gently touch. Okay. All right, now I want to look at the inside of your mouth. Okay, if you just open real wide for me. Okay. I'm just looking at your throat, at your pharynx. Okay, can you swallow for me? Okay, see your, it's really hard to see your uvula actually. Okay, I want to look at your Stinsons and your Wharton's ducts. Your Stinsons, if you, I'm just going to put this right here. I'm just going to look on the very top, right here. I'm going to look at this side, sorry. Okay, and if you'll put your tongue up to the roof of your mouth for me. Okay, all right. Okay, and we'll look at the hard and soft palate. I think it's attacked. Okay, very good. All right. Now, I'm going to check your gag reflex. Look forward for me a little bit. Can you tilt your head down just a little bit? Okay. Promise I'll be gentle. Well, that's pretty good, right? All right. Actually, that also assesses cranial nerve number 10, your vagus nerve, watching the uvula go up and down, as well as the gag reflex. Now, what I want to do is, well, you know what, I forgot to check your teeth. Let me just make sure. No problems. I noticed, wow, no cavities. Huh? Very good. You look like you got sealants. You have sealants on your teeth? Did they do that to prevent you from getting cavities?
Got a couple of crowns.
Really good. Okay.
And a broken.
All right. Now, the last thing that I want to do, and I'm going to be honest with you, most people don't like this very much, is I'm going to get you to stick your tongue out. First, I want you to stick your tongue out and just stick it out and just move it from side to side for me. Okay. All right.
So now I can look at y'all.
Do what?
I get to lick that gauze.
Absolutely. Well, you don't get to lick it. I'm gonna but I'm gonna place it on your tongue. I'm sorry. That is actually sticking your tongue out from side to side. And if you will, before we do this, push your tongue on the inside against my fingers on this side. Okay, that's just checking your tongue strength, and that is assessing cranial nerve number 12, which is your hypoglossal nerve. Okay. All right. So now I want to look at your tongue. So stick it back out for me. Okay. I'm just going to look at the underside. The reason that we look at the underside is because this is the most common place for oral cancer. So I always want to look at that. All right. Okay, so we're good with that. Okay, moving on. We're going to do a taste test. I know you're going to enjoy this.
Sure.
It's not too bad. What I want you to do is, every area of your tongue has certain taste buds. Okay, so what I'm going to do is I'm going to have you close your eyes, and I'm going to put different flavors on 4 different areas of your mouth, and I want you to tell me what you're tasting. You don't have to tell me specifically what it is. I just want you to tell me if you taste sweet, salty, bitter, or sour. Okay? All right. So go ahead and close your eyes. I'm trying to make sure that I'm not getting too much of the...
Let's go ahead and begin the lower extremity exam. Okay, for this part we won't need the drape, so I'm just going to pull your gown down and we'll get rid of the drape. Okay, and I'm going to inspect the skin for any lesions, discolorations, also looking at the texture and temperature. Okay, and then we'll just pull your gown up to here. How's that? Okay. And we'll go ahead and palpate the hip joint and thighs, knee, patella, and popliteal fossa, checking for pulses and cysts. Okay. And calves, Achilles tendon, calcaneus, lateral and medial malleoli. Okay. And we'll check posterior tibial pulse and dorsalis pedis. Good. Do a general inspection of the metatarsals and toes and capillary refill. Good. Okay. Now let's look at the range of motion of your legs. Just have you lift your leg off the table, all the way up and back down. Good. And now I'm going to move your leg for you, okay? Move it in abduction and adduction, okay? And flexion, extension. Do external rotation and internal rotation. And Patrick's. That looks very good. Go ahead and do the same on the other side. Again, flexion, extension, abduction, adduction. Okay, go ahead and bend your knee. All right, do external rotation, internal rotation, and Patrick's. Good. Good. Okay. Now I'm going to have you sit up, okay? So now I'm going to go ahead and test the strength against resistance of your lower extremity, okay? Go ahead and try to lift your leg off the table and push it down towards the table. Good. And off the table and press down towards the table. Good. Go ahead and try and extend your leg and pull it back towards you. And extend your leg, pull it back towards you. Good. Now looking at the range of motion of your feet. Can you bring your toes up and back down? Okay. And bring the soles of your feet together and away. Good. Can you lift your big toe up? And how about all of your toes up and back down? Good. Okay. And now just relax your foot. This time try and raise your toes up towards you. And now push them down towards the ground. Looking at dorsiflexion and plantar flexion against resistance. Good. Okay, I'm going to have you step off the table here so we can look at your back. All right, I'm going to come around to this other side. All right, and I'm just going to inspect the back, looking at the skin again, and looking for the symmetry of the iliac crest. I'll have you lean forward Go ahead and look at the curvature of the spine. For any lordosis, kyphosis, or scoliosis, you can stand up. Okay. Now, I'm going to keep my hands on your hips. I'm just going to look at your range of motion a little bit. Can you lean backwards from your hips? Good. Okay, and now to one side. And to the other side. Good. Now, keeping your hips facing forward, just twist so you're looking behind you. Right. And the other side. Good. Excellent.